The Center for Health Administration Studies has factored prominently in helping to illuminate and unravel the most pressing issues in health policy, health services, and healthcare through its programs of research and teaching. As those of you who know SSA already know, our broader mission is to provide intellectual and professional leadership on matters of great concern to social welfare, and one of the distinctive hallmarks of SSA is that we address social and human welfare concerns through a vigorously interdisciplinary set of lenses. We're thus proud that since coming to SSA, the Center for Health Administration Studies has taken on an even more interdisciplinary approach and thus is very well positioned and energized to take on the very complex and multifaceted and indeed tough issues of healthcare reform. It's been now 3 years since President Obama signed into law the Patient Protection and Affordable Care Act, otherwise known as ACA. To this point, as every one of you knows, it's already been quite a ride. Yet, in many ways, the heavy lifting of healthcare reform has barely begun. We cannot know right now, but we'll soon know how all the moving parts of healthcare reform work together, and with this, the stakes could hardly be higher. For cost, for quality, and for the efficiency of American healthcare. The consequences for healthcare access and for equity will be equally profound. With this, then, I'm especially delighted that the Center for Health Administration Studies is continuing to provide important intellectual leadership in honor of its 50th anniversary by pulling together some of our foremost leaders in health policy and research to specifically consider the consequences of healthcare, of the Affordable Care Act. I would personally just want to thank colleagues Colleen Grogan, where are you, Colleen? And Jeanne Marsh. Jeanne, I know you're here. And Harold, where are you? There you are. And then Janine Jesberg. Janine, are you here? Janine's outside? Yeah, she's working. Okay, so for pulling together such a stellar group and such a spectacular day today for you all, I want to warmly welcome you all and wish you a very stimulating conference.
Thanks very much, Neil, for getting us off to a great start. Neil has been a great supporter of the work of CHAS, and I really appreciate your being here bright and early. I appreciate all of you being here bright and early on this Friday morning. We have a lot of work to be done today, and it's my job to keep us on track. So that's going to be my sincere effort. As you all know, this fall, health insurance marketplaces must be up and running in every state. States must decide, thanks to the Supreme Court, whether and how they will expand Medicaid coverage. State insurance commissions must decide delicate matters such as how rich a package will be required as an essential health benefit. Private insurers must alter the way they do business. Individual citizens will be expected to obtain insurance coverage. The experts, all of you here today, find many aspects of health reform daunting. I know I do. Soon, everyday people will face the same complex challenges as millions of people seek to gain access to the help they need. We're so fortunate today to have this opportunity to have such an all-star cast of practitioners and researchers to give us a sense to reflect on what's been accomplished so far and what's uncertain, where we have to go. We have today health economists, clinicians, sociologists, political scientists, social service researchers, all applying their perspectives in the best traditions of the University of Chicago. On this 50th anniversary year for CHAS, it's especially gratifying to see so many people here who have played a key role in making the University of Chicago a center of health policy and health services research. I'm going to reflect a bit on what we have before us, what we're going to accomplish today. It's a really quite exciting agenda. And we're going to begin with the difficult issue of disability policy. Many here have worked with disabled clients or patients, some of whom are duly eligible for Medicare and Medicaid. The collapse of the Class Act in health reform literally before it began, highlights the challenges that Howard Gleckman, Judy Fader, and Tamara Koketska will discuss. There is just no topic more intimate to our humanity than the issues in play here, and no topic more difficult to handle in public policy. Then we have David Cutler, Richard Frank, and Harold Pollack on board to discuss some core issues that will shape the legacy of the new law. Will health reform bend the cost curve? How will the ACA's coverage impact vulnerable populations? Then over lunch, Sherry Gleed has agreed to describe what it was like to serve as the ASBE and to provide policy support for both the passage and the implementation of perhaps the most complicated and contentious social policy legislation in the last 40 years. After lunch, we'll hear a more philosophical, reflective perspective that we're generally used to hearing in nuts and bolts policy debate. Julia Lynch, Norm Daniels, and Colin Grogan will discuss equity and fairness in health reform. What do terms such as affordable really mean when we design deductibles, co-payments, and out-of-pocket spending limits for participants in health insurance exchanges? How do we balance the need to fairly share risks within social insurance while providing incentive for efficient use of healthcare resources? Then, still on track, we will shift gears to consider delivery issues. At the 50,000-foot level, virtually everyone in health policy understands that we should move away from the fee-for-service model and make greater use of comparative effectiveness research. Both things are tremendously difficult to do. Eric Potashnik will discuss survey research in which voters are asked what we really want from comparative effectiveness research. John Skinner will then discuss accountability care organizations and their impact on equity of care. And our colleague David Meltzer from across the Midway will reflect on both of these presentations from the unique vantage point of being an expert on medical cost effectiveness and a physician with specific responsibilities to a specific group of costly and complex patients. And then one of the grand figures in public policy, Hank Aaron, will lead us to a brilliant synthesis of everything we've heard up to that point with his talk rather ominously titled, Today in Health Reform, the Calm Between the Storms. This is an ambitious agenda. I feel we're so fortunate to have all of you in this room to tackle it, and I think we should just get started. All right, first up, we're not going to have introductions because there are elaborate bios in your program. So please, our first speaker.